Hello, ladies and gentlemen. Welcome back to UK Dreamers. This is Aman, and in today's video, we'll be talking about the higher specialty training in renal medicine. And to deliver this complicated topic, we have none other than our veteran speaker on UK Dreamers, Dr. Pranesh Jain, who you can see and find in the previous videos about MTI, renal medicine, and MTI, FAQs. So, without further ado, welcome, Pranesh. Welcome.
Thank you, Aman. Thanks for inviting me for this video,
Thank you so
and
much.
can't wait to share my experience.
That's great. So, firstly, heartiest congratulations, brother, because ST4 Renal Medicine, great stuff. So, you would be
Yeah.
guiding all the people, be it IMTs, be it people who've come from overseas, who are working as clinical fellows, specialty doctors, those who want to go into higher specialty training in nephrology, renal medicine. So, Pranesh, tell us a little bit about your journey just to bring people up to light who haven't seen your previous videos.
So, a bit about myself. I came to the UK in 2020. So I came from India. I came. When I came to the UK, that was the time when you had to quarantine for 14 days. So I came when the first wave was, completing its course in India, and the second wave was beginning its course in the UK. So it was a time when it was everybody was wearing mask. I came as an MTI, completed 2 years as the MTI, and then I got an offer to become senior clinical fellow in renal medicine in the same hospital. It was renal medicine plus high dependency unit, because the renal medicine department control or had their own HDU, medical HDU actually. So that was my 3 years there, and then I entered into the higher specialty training. The first 2 years, I didn't think I had any clear plans, but I did take that time, and I cleared my MRCP. That's again a story, and then I entered into the training. It was a journey, quite a journey, and I think we'll talk a bit more in detail about how to get into training and you know things about renal training.
Absolutely. So, Pranesh, I mean, I remember we having a chat, I think about 2 years or so when you were still sorting your MRCP exams, when you thought, whether doing Caesar would be a good choice. What happened to that idea, man? Why did you ditch that plan?
So Caesar is very interesting. The good thing about Caesar is that you don't have to get into the formal training. You don't have to spend for 3 4 years, whatever time, to get into this. But I don't know. I may be wrong. I may not have studied or researched Caesar properly. But the impression I got was that it's something which can save a bit of time, but GMC has its own set rules, and it sometimes can take almost equivalent time as CCT. It doesn't give you any more advantage than saving 1 or 2 years of your before you become a consultant. But regardless of what you say, there is CCT is a structured program where you don't have to worry about anything. It's something which is well structured. You just have to enter it. Entering it may be difficult, but once you enter, there is only and only one possible outcome. You don't have to worry about anything, which is the best thing about CCT. And then you rotate into good hospitals. So if you don't have problem in working, you get more exposure, even more exposure than you have already. And then it is made sure that you get exposure of a transplant unit. It is made sure that you get exposure of the procedures, clinics, and everything. So that was after I spent around 6 months, I felt that I have already wasted 6 months. Regardless of what I do, I have to clear cases. Regardless of what I do, I have to do all these things that would have to be done. Best case scenario with Caesar, I may save 2 years, but it was equally possible that if I enter into training, they may give a discount of having spent so much time in renal. And
Hmm.
then it was like, why don't we take why don't I make my life easy and just work slowly and steadily?
Absolutely, absolutely. So, Pranesh, tell us a little bit about your journey, or you may say, how did you make your CV look or your portfolio look absolutely outstanding, like before the interviews, of course, before, like when the long listing process, like,
Yeah. So just one more thing. I think you already have a video about alternate certificate of competency, Aman.
yeah. But
That
I
was
think,
one thing that was
yeah, I
essential.
think what you can touch upon, Pranesh, because it keeps on changing. I think the last video I made, that time you could get it countersigned overseas, but I don't know if that has changed now or there any new set of rules now.
I think the last I checked, you can still get it signed. It
Yeah.
has to be somebody who is a consultant
Okay.
and is a member of Royal College.
Okay.
But I think it's always better and safer if it is a consultant in NHS or in the UK.
Yeah. I
That is
totally
something that I
support
got.
that. Yeah.
Yeah.
Okay.
So what I did was, once I made up my mind that I definitely, after I spent 1 year and I waited 1 year, that I decided I definitely want to take up the training. I then had a chat with my education supervisor, who is a very clever and wise man. He told me that, Pranesh, why are you making your life difficult? Whatever you do, you have to do these three things, even this or that way. I know you. He was the guy who interviewed me for MTI. He's like,
Okay.
I know you. I have your portfolio. I have your logbook. I can sign your alternate competency certificate, which will then save you some time. You work on your paces. I didn't clear my paces then. So what happened was, I came to the UK in the first 2 years. I took MRCP part one and then part two. I failed in part two, I think 2 or 3 times because I took it very lightly. And then I kind of was like, okay, I'll take some time and I'll do paces later. But then what happened was, fortunately or unfortunately, during COVID, um, there was a JRCBTB had a rule that you can clear paces even after entering the training,
Yeah, that's correct.
which rule was just removed when I wanted to get into training and when I didn't have paces. So then paces become mandatory for me. I took paces. I did not clear the first time, but I did apply for training in anticipation that I might just clear. I got a training number and I got my first preference. But unfortunately, I had to give up. And then I took paces again, cleared it. And in terms of your question, what did I do specifically? So what? So I had. So this is what the renal training application, or I think any training application has few headings and subheadings. One of them is commitment. So commitment is based on what you've done, what your profile looks like. Have you worked in renal? Do you appear to be interested in renal, or is just one of the options you have? And then your experience in teaching, your experience in QIPs or audits, your experience in leadership, your qualifications, and few other things. It is all available very freely and very clearly in the ST3 recruitment website. I went through this application process. I filled everything, and then I was longlisted. The only two things that I had which made my profile um, more competitive was, I had two papers that were uh, published in PubMed indexed journal.
Okay.
That made it better. That made it more competitive. And then I had a good leadership as well as teaching experience, which I did one during the time of COVID back in India.
Yeah.
So these are the things that made it more competitive. Once I was longlisted, then I had to go for interview. I did interview, and then um, you have to give your preference, and then based on your preference and based on your rank, you get your choice.
Okay. All right. So, any specific preparation tips for guys and girls who want to do nephrology?
Um, I think anybody who wants to do nephrology is quite clear, because it is one of those branches which is not straightforward. I have seen people who made their mind they would never do renal, but they ended up doing renal because then they found it interesting.
Mhm.
The good thing about nephrology is it is full of everything, whatever you are interested in. If you're interested in research, it has, you know, in a lot of research going on in the field of dialysis, transplant, immunosuppressants, and you name it. Procedures, it is procedure heavy. Clinics, you can do clinics. If you don't want you don't want on calls, you can avoid on calls. Just take some part of your PAs for academics. So there are many advantages of renal. The one big disadvantage is it can sometimes be quite intense, which is, I accept it is a disadvantage. Uh, I think one thing that I would suggest in terms of tips is that you should always have targets. In your first year of IMT, you have targets. Similarly, when you get into training, you should have targets that when I enter my training, I would be able to sacrifice this, this, and this if I get this, this, and this. So, for example, my preference was experience in kidney and pancreas transplant. So it was like if I get into a place which does kidney pancreas transplant, then it would be very, very useful for me
Okay.
because this is something rare and only 3 centers in the UK do it. And the other thing was peritoneal dialysis, which is also something which is high in demand. And then surgery for EPS and capsulating peritoneal sclerosis. Only 2 centers in the UK do. One of them is Manchester.
Mhm.
So yeah,
So that made you choose your preferences because what you wanted to do, you already knew which centers were doing it and which one centers were.
true. I think that's a very good point that you pointed out. Not all the applicants are in my position because I already had an experience of nephrology before I applied for the training job.
Yeah.
So, and I see a lot of IMB3s who don't have much experience in detail. But I would suggest that it's always best to whoever is your supervisor, just ask them to connect you to anybody in nephrology, somebody who is in the field for at least 10 to 20 years, will have a very good understanding of what nephrology is. And then also having a chat to the new consultants who become consultant in the last 5 years, they would have a very good understanding of what it has become. So you should always have a chat to at least two consultants, and then they can guide you properly.
Okay. Great. So you were saying that you would share some slides, for people.
Yeah.
Yeah.
So, so there was, I have a friend who basically told me about this website, which I think everybody must already be aware now, but I wasn't. And I just wonder sometimes people think that everybody would know a lot of stuff. So this is something that I did not know about when I was applying. This is a website, Physician Hires Specialty Training Recruitment, PHST recruitment.org.uk. It has a lot of information, and it has every information of every specialty. If it is group 1 medicine, group 2 medicine, or what, you just name it. And it would take you through the whole process. You would also be able to find out details about different regions, different deanery. So this is what I did. I went through this website, and then, so this is the first page. I went through this website and I looked at uh, each and every page of this. It tells you recruitment. How do you plan your application? Are you eligible if there's something that is an eligibility criteria? Assessment methods of application. What are the evidence that is required to be uploaded? Then, if you want an academic clinical fellow, about rounds of interview or process. And this is the page for renal medicine. It tells you again the same thing, including interview dates, hosts, interview scores, and how they are scored. And it also tells you how is interview done. So I'll show you in the next thing. And it also has data. You can also find out data of every deanery and all of the past interviews. Um, so coming to the interview is basically divided in two sections. One is renal, one is medicine. So as you know, anybody who chooses nephrology, it's a dual CCT program. It's renal medicine plus general internal medicine. Up to, I think, 2 or 3 years ago, you could give up general internal medicine and just do single CCT in renal, but they have now um, taken out that option. So you have to do both the stations, both the CCT. So one of them is medical registrar suitability, and the second is renal registrar. So what they do is they divide it in two different stations. So there are two different panels of interviewers. Mine was virtual interview. So once you get into the interview, they give you a link. It's a different platform. You log into the link, and then you will have a video chat. There would be there are three people in panel. Two would be consultants, and one would be an independent person who would be there to make sure everything is fair. The interview process is very, very transparent and fair. They have strict and specific things that they would mark you against. So as you were saying, so first station would be they would give you a clinical scenario. Second, they would give you ethical scenario in renal, and in this second station they would be questions about your suitability of medical registrar. So they will ask you questions around uh, life of medical registrar. So the questions that I was asked was, uh, tell us about one of the days when you were working as medical registrar, which was the toughest day, and how you managed it well. Similarly, they would ask you, what are just tell us how is a post-take ward round done. So what is an ideal post-take round? Things like this. They don't want, a specific answer. They just want to see if you know what it is like to be a medical registrar. And they also expect things around problems of staffing, problems of bed availability, problems of 6 hours in the queue, and how you're going to manage all of that. If you are the single person, once a consultant is not with you, how you're going to manage, and can you keep your brain, your mind, and everything cool. So this, so and then there's a specific column for communication. How you communicate, they also mark it. For nephrology, they would ask. So one of them was ethical, one of them was clinical. In clinical, they don't expect you to know. Obviously, they don't expect you to know core knowledge of nephrology. Just they want to make sure that you know about the basics of emergency situations. For example, hyperkalemia. The most common thing is hyperkalemia. A bit less common is vasculitis. How would you identify? How do you work up? And then how do you manage? For ethical, very common scenario that most people get is somebody who is either very young or very old or has learning disability and has problems with dialysis. So these are the questions for interview. What I did to prepare for interview was, there is a book of ST recruitment interview preparation. I did not go through the whole book. I just went through, I think, 10 or 12 pages. There are some pages where they tell you specific. So they have mnemonics of dealing with difficult consultant, for example, dealing with difficult patient, dealing with difficult scenario. I went through all that. I did a mock interview session with my consultant. A lot of consultants are very handy, and especially the new consultants who have recently taken the interview or participated in interview, they would be very happy to, you know, be with you for 15 minutes, and then they'll take mock interview, and then they'll give you feedback. This helps a lot. Apart from this, there are many courses, some of them in London, which I have not done myself, but they are also very highly rated to prepare for interview.
Okay. Great. So, I mean, as you said, interview preparations can be done at your own center. Your seniors can help, but it's not mandatory that you should go and do the other interview, isn't it? Like that's what you're saying. The other
Yeah,
interview
yeah,
mock
yeah,
preparations. All right, cool. So,
yeah,
Pranesh, take us a little bit into the training itself. How long does it last? As you were
yeah,
talking a bit about transplant and stuff. So, how long does it
yeah.
last? And to my understanding, people who also want to do triple CCT, renal medicine is
Yes,
one of the branches you can apply for critical care along
yeah.
with GIM and nephrology. Yes, your span increased by I think 1.5 years, but Pranesh is gonna tell us more about it.
So yes, you're right. A lot of people do triple CCT with nephrology, nephrology, general internal, and critical care. And some people also do nephrology, acute medicine, and intensive care medicine. It is to find out the centers which do it, and then obviously it's I think it's a 6 year thing rather than 4 year. So renal training now is because it starts from ST4 compared to ST3, what used to be the case until 3 years ago. It is a total of 4 year training, ST4, 5, 6, 7. In these 4 years, so the curriculum states that you have to have at least 3 months of general internal medicine every year and at least 6 months of proper nephrology in your last year. So it's I think it varies from deanery to deanery, but a lot of deanery what they do is they give you some medicine every year, and if you are in nephrology, they might couple of months they might ask you to do on calls in medicine rather than nephrology, or do medicine and do on calls in nephrology. So you would be in your ambulatory care or medical STEC, whatever it's called in in that hospital. They rotate in obviously they rotate you to a few hospitals. So I have so I was in Derby before, which is East Midlands North, and now I'm in Manchester. So Derby has four hospitals. One is Nottingham, which does the transplant. So every nephrology trainee has to work in the transplant center. Every deanery will at least have one center which does transplant because the curriculum states that you have to have at least 6 months of transplant exposure. I mean, acute transplant. Every hospital would have chronic and stable transplant patients, but acute transplant, you need at least 6 months, which is why everybody in East Midlands North will definitely go to Nottingham at least once. And then there are other centers. Some would be purely medicine, some would be nephrology plus medicine, some would be purely nephrology. So East Midlands North has Nottingham, Derby, Lincoln, and Mansfield, or it's also called Kingsmill Hospital. These are the four hospitals in East Midlands North. Nottingham is purely renal. Derby is nephrology plus medicine. Lincoln is again nephrology plus medicine. Kingsmill is pure medicine. East Midlands South also has, I think, four hospitals, but you have to travel a long distance for one or two of them. So I have noted that most of the deaneries has at least one hospital, which is a bit of a commute.
Yeah.
So in East Midlands North, it is Lincoln. East Midlands South, it is two. One of them is Northampton. One of them is, I think, Peterborough. In Manchester, you rotate only in three hospitals. One is Manchester Royal Infirmary, which does the transplant. So the good thing about this hospital is they do kidney pancreas transplant. They do surgery for EPS. So patients are referred from all over at least half of the country for their EPS surgeries to Manchester Royal Infirmary actually. And they have a big center for research. Second hospital is Salford Royal Hospital, and third is Royal Preston. The good thing about this deanery is all three hospitals are medicine plus nephrology.
Okay.
You also get posted in ICU as a part of your internal medicine curriculum. I mean, some of them can, some of them would not want. So your 4 years is divided in this way that out of 4 years, 1 year in total would be medicine. 3 years would be nephrology. And of these 3 years, at least 6 months will be in your last year. And at least 6 months will be in a center with just transplant. Some may have more than 6 months in that center. Then it used to be the case that there were a lot of procedures that were mandatory, but now it has been modified to only temporary dialysis catheters to be mandatory to finish CCT. But almost all the deaneries also train you for permacath, kidney biopsies, and some deaneries also train you for PD catheters. Very rarely, some centers which have interventional nephrology, they would also train you in doing fistuloplasties. So I know that Newcastle, Sunderland, and Salford, they do fistuloplasties. So nephrologists do their fistuloplasties, which is very, very, rare thing.
Mhm, mhm. Okay, so you've given a very, very insight into the depth of the basically training
Yeah.
and stuff. So, Pranesh, to conclude this, what would your take-home message be for the guys and girls who want to do nephrology, and anything in particular that you would say from your experience can be done differently to make things better?
I think to have some QIPs to begin with in the field of nephrology is something that would help a lot in your training application. Also, to have a field of interest would be useful. So, a lot of people have interest in transplant or dialysis or vasculitis or glomerulonephritis. If you have an interest in one specialty, that means that you know the specialty, which is why you have one topic of an interest. And and then I think about research, because research is something which is common anywhere and everywhere you go. If you have thought of research and if you have an idea of research, that also makes you basically helps you stand out of the crowd.
Yeah,
But
absolutely.
other than that, yeah, the only thing I would say is don't get scared of renal medicine. I know it's, I know it's daunting sometimes,
Yeah,
but
I mean,
it's
I've
easy.
heard people, you if you do renal medicine, you can't keep a balance in your life. It's very hectic, it's and stuff. So, any comments on that?
So I would not say that is incorrect completely. It is definitely hectic, but it also depends on which center you are in and what kind of job you have, what kind of PAs you have. So the what I have heard is the most busy and most hectic hospitals in the whole of the UK are one, Birmingham, and second, Manchester.
Don't do it there.
And I know this is, Birmingham and Manchester are there. They are chaotic because they are overwhelmed with the patient flow. But what doesn't kill you only makes you stronger, Aman.
Absolutely, absolutely. So, guys and
Yeah,
girls, if you've got any further queries about ST4 nephrology, as Pranesh has suggested, go through the website, make your CV stronger, and have a very, very strong heart before jumping into nephrology. That's what I think
yeah,
Pranesh
yeah,
would also say. Cool.
yeah,
So thank you so much, Pranesh. That was really insightful. So, guys and girls, if you want to do nephrology, as we said, work on it. It's not that easy. It's competitive. It is a bit of, you know, for the strong-hearted people, because yes, there is complexities. The patients are complex. I mean, I would say whenever I work, and wherever there is a call on nephrology, I know, oh boy, this is not going to end up well. I mean, one of the most dreadful scenarios was, like I was called in nephrology to see a patient, and the patient wasn't well. I went to see this chap. He stood up and he fell face first, went into a cardiac arrest, did not revive. I mean,
gosh.
for me, because I've just transitioned from emergency medicine to medicine. This is that time basically. But I
Yeah.
mean, I understood, because that did not, make me anxious or something. But it was just that feeling, because the patients of nephrology, the renal patients, can be
Oh, I
very.
totally agree. But you have to also look at the bright side. So nephrology is one and only field or one and only specialty which can give you the the variety. It can give you it. There's a huge spectrum of things that you can do. You can obviously opt out things that you don't like, and the patients of nephrology, in nephrology you tend to own patients from beginning to end, because they are your patient when they have chronic kidney disease. They're also your patient when they become dialysis dependent. They are your patients when they get kidney transplant, and it's a journey. So you know them from beginning to end, and they know, if there's any problem, that, oh, this is my kidney. So which is why there's a huge amount of job satisfaction as well, I would say. No other field would give you, for example, if if somebody has kidney which is failed, they would still be able to have dialysis, and they would still be able to have normal life, which is, a lot of times quite rewarding. Somebody who was about to die because of vasculitis is now, is able to perform his daily routines well.
Absolutely.
So yeah, so there are
Absolutely.
positive aspects as well, a lot of positivity as well.
So, guys and girls, if you think we were doing this in our free time, oh, I can't make you guys see. It is 8:47 in the night, and me and
Yeah,
Pranesh
it
are
is.
just, I'm sneaking in my sunroom to make this video. I think Pranesh has sneaked
Yeah,
somewhere as well. So please like and share
yeah,
the videos, guys. We take a lot of effort to make
yeah.
these videos for you guys. So show your love, show your appreciation, and we'll see you in the next video soon. All right, guys. Thank you so much. Thanks, Pranesh. Take care. Bye.
Thank you. Bye, bye, UK dreamers.